present the results of our study. My presentation today is on the prevalence and types of psychosocial comorbidities in patients with vitiligo, as determined through a systematic literature review. Here are my complete disclosures. Vitiligo is a chronic pigmentary skin disease resulting in patchy loss of skin color due to melanocyte loss. Vitiligo onset typically occurs around the age of 13 years or younger, but lesions can appear at any age. The global prevalence is approximately 0.5% to 2% depending on geographic location. Patients experience high psychosocial burden, which contributes in those patients to reduced quality of life. The objective of our study was to describe the prevalence and types of psychosocial comorbidities in patients with vitiligo via a systematic literature review. We performed a search on PubMed, Embase, Scopus, and Cochrane database from the earliest respective entries through December 31, 2019. We also performed supplemental searches to identify more recent articles. The search was limited to articles published in English, and the following keywords were used: vitiligo, quality of life, burden, psychosocial, and anxiety, as well as variants of depression, stigma, psychology, and psychiatry. We included primary publication, including clinical trials and observational studies, and we excluded all studies with less than 5 patients with vitiligo. Extracted data included type and prevalence of psychosocial comorbidities and factors associated with psychosocial burden. Data were also collected for healthy controls whenever these data were available. In total, we almost identified 2,000 records, and after removal of duplicate, we screened 1,022 records. Data were extracted from 149 articles that fit our inclusion criteria, and the detailed Prisma diagram is depicted here. Included studies were published between 1979 and 2020, with the majority of these studies, almost 69%, that were published in the last 10 years. Study characteristics are summarized in the table, which shows that 98% of the included studies were observational, and that the majority of these studies were conducted in Europe and Middle East. A wide range of sample size were reported, and 53% of studies were conducted only in adult population. Patient-reported prevalence of a variety of psychosocial comorbidities, which are represented comprehensively in the following slides. Depression and anxiety were the most commonly reported psychosocial comorbidities, but many others were also widely reported. The heterogeneity of studies included in the analysis is reflected in the broad prevalence ranges. When compared with healthy controls, the prevalence of a number of psychosocial comorbidities was significantly higher among patients with vitiligo. These include adjustment disorder, alcohol abuse or addiction, alexithymia, anxiety, depression, embarrassment, emotional and behavioral impairment, low self-esteem, relationship and sexual dysfunction, self-consciousness, sleep disturbance, and suicidality. Depression and anxiety were the most commonly reported psychosocial comorbidity, with prevalence of up to 62% and 68% respectively. Coexistent depression and anxiety were also reported with a prevalence of 5 to 33%. Various impairments were noted, including emotional and cognitive impairment with prevalence of up to 65% and 51% respectively. The prevalence of behavioral impairment that included avoidance or restriction behavior was up to 76%. Patients were affected by adjustment disorders such as hopelessness and stress associated with vitiligo that were prevalent in up to 94% of the patients. Up to 67% of the patients in the included study experienced self-consciousness, and 3 to 25% reported suicidal ideation. Vitiligo also contributed to feelings of stigmatization with a prevalence of 17 to 100%. Sexual dysfunction, sleep disturbances, alexithymia, and anger were also prevalent in more than 30% of the patients. Finally, alcohol dependence or abuse was reported in 2 to 8% of patients with vitiligo. Factors significantly associated with higher psychosocial burden included female sex, lesion location on visible areas or on genitals, extensive body area involvement, and younger age, particularly those below 30 years of age and more so in adolescents, among others. So, as a conclusion, the results of this systematic review support previous findings specific to the association of vitiligo with depression and/or anxiety, and also highlight additional psychosocial disorders of stigmatization, sleep disturbance, and emotional impairment, among others. The prevalence ranges were often large, reflecting the heterogeneity of the studies. Further assessment of factors such as geographical regions and cultural differences may shed more light on the contribution of psychosocial burden to reduced quality of life in patients with vitiligo.